Great. Welcome, everyone. We are just getting started. We're waiting for folks from the waiting room to be let in, so we'll start in just a minute here. Awesome. Okay. Well, welcome everyone. Good afternoon, committee members and members of the public joining us for this meeting. I'm Cody Ziegler, the Director of Statewide Policy here at the California Interagency Council on Homelessness. I have the pleasure of opening our meeting today. So thank you for your commitment in joining our efforts to prevent and end homelessness in California and for being with us today. A few reminders before we begin. This is a 2-hour meeting and we'll do our best to keep to this time frame, but there's always a possibility that we may go over that timing slightly. Prior to this meeting, committee members were provided with the agenda and any briefing materials, which are also available on our public website. We'll try to leave some time for committee members to ask any questions towards the end of the meeting, but if we run out of time, you can always email us, reach out to us with the email that we provide at the end. So on the next slide, we'll see the agenda for today's meeting. So we have our call to order and our tribal land acknowledgement, and we'll call a roll. Then we will go through the consent calendar and vote on the meeting summary from the last meeting. Our executive officer is unfortunately ill today, so she is not joining us, so we won't have executive officer updates there. So we'll jump right into our first agenda item, which is around our local initiatives division and talking about the resources that they are putting together for both state partners as well as local partners, and getting your all's advice and sort of guidance as to how to use those resources effectively and how to get them out to the community who needs them. So they'll talk a little bit about that, and then we'll go back to everyone's favorite agenda item, the action plan. So I will present to you all on sort of the finalized elements of the plan, go through like sort of at a high level the different pieces of the plan that we are going to be presenting to the council at their meeting on December 3rd for their review. And then really asking you all like how, like the focus of the discussion will be around how do we ensure that this is a useful tool for all of the spheres that you all represent, right? All the different types of work that you all do. How can we make our action plan as useful as possible for those folks? So then we'll move into general public comment and adjourn the meeting. And as we mentioned at the end of the meeting, there is an opportunity for general public comment. Just as a reminder, we allow for a maximum of 2 minutes for each comment. We welcome all public comments and feedback. However, due to the structure of the public meeting we're in, we may not be able to respond to all of them. So for this reason, if you have any specific questions for CalICH that you would like answered, we ask you to email us at calich@bcsh.ca.gov, and I will put that email in the chat for everyone. So with that, the advisory committee is called to order on November 12th at 1:10 p.m. I will now pass it to the CalICH Tribal Liaison Vavila Blossoming Bear to read our tribal land acknowledgement.
Good afternoon. Thank you, Cody. Good to see everyone today. We wish to acknowledge that Sacramento is the unceded homeland of the Southern Maidu, Valley and Plains Miwok, the Nisinan people, the Patwin Wintun people, and members of the Wilton Rancheria tribe who have inhabited this landscape since time immemorial. We extend our gratitude to the ancestors of all California Native American tribes and their descendants, as we recognize that wherever we are joining from, provided we're in California, we are on California Native American lands. Thank you.
Great, thank you, Vavila. Now I will pass it to CalICH staff, Claire Bannerman, to please call the roll.
All right, hi everyone. This is the attendance roll call for the committee. We need a majority of members or a quorum to officially meet and hold this meeting. Advisory committee members, after I call your name, please say present or here. Apologies if I mispronounce any names. Ludmilla Bade. Al Ballesteros. Samantha Batko.
Present.
Doug Bond. Carolyn Coleman. Joe Coletti.
Here.
Thanks, Joe. Charlene Demas Pianato. Vitka Eisen. Dora Gallo. Jennifer Hark Dietz.
Present.
Thank you. Eric Harris. Charles Helgett. Janet Kelly.
Present.
Thank you. Jody Ketcheside.
Here.
Philip Mangano. Chris Martin.
Here.
Mariah McGill.
Present.
Thank you. Luana Murphy. Elisa Orduña.
Present.
Sharon Rapport.
Here.
Janie Roundtree. Emilio Salas.
Present.
Miguel Santana. Sean Spear. Reba Stevens.
Present.
Thank you. Megan Van Zant. Alex Fitzosky.
I'm here.
Thank you. Javon Wilkes.
Here.
Thank you. And Roxanne Wilson.
Here.
Thank you. Okay, we have a quorum, so I will move us to the next agenda item. Next slide, please. So this is the consent calendar. The consent calendar is for regular or non-controversial items that need to be approved by the committee via a vote, where we do not expect any members to discuss, but they may engage in a discussion on any items in the consent calendar if they so choose. We have one item, the adoption of the August 22nd committee meeting summary. Are there any comments from committee members? Before proceeding, since this is an action item that will take place, that will result in a vote, we will now open it up for public comment. Please keep your comments to the item on the consent calendar only. If your comment is not related to the consent calendar, there will be time for public comment at the end of this meeting. If you're connected through Zoom, please select the raised hand icon in the meeting window on your computer. And for those joining, you may press *9 to indicate that you would. Once items to comment. Okay, I see no public comments. We will now move to vote. Is there anyone who would like to motion to approve the meeting summary?
So moved.
Do we have a second?
I'll
Just
second.
a second. Go ahead, Joanne.
Thank you. We have a motion to adopt the meeting summary. I will now call roll for a vote. As I say your name, please say aye or yes. You may also abstain or vote no. Ludmilla Bade. Al Ballesteros. Samantha Batko.
Aye.
Thank you. Doug Bond. Carolyn Coleman. Joe Coletti.
Yes.
Thank you. Charlene Demas Pianato. Vitka Eisen. Dora Gallo. Jennifer Hark Dietz.
Aye.
Thank you. Eric Harris. Charles Helgett. Janet Kelly.
Abstain.
Thank you. Jody Ketcheside.
Yes.
Thank you. Philip Mangano. Chris Martin. Mariah McGill.
Aye.
Thank you. Luana Murphy. Elisa Orduña.
Aye.
Thank you. Sharon Rapport.
Aye.
Thank you. Janie Roundtree. Emilio Salas.
Yes.
Thank you. Miguel Santana. Sean Spear. Reba Stevens.
Yes.
Thank you. Megan Van Sant. Alex Vitsotsky.
Aye.
Thank you. Javon Wilkes.
Yes.
Thank you. And Roxanne Wilson.
Aye.
Thank you. The motion passes. The meeting summary is approved. And now I will turn it over to Cody to facilitate the next item.
Great, thank you, Claire. Thanks, everyone. So we can move ahead a slide. Okay, so we don't have executive officer updates, but before we jump into this agenda item, I do want to just acknowledge that Cal ICH has a slight change in structure that we're really excited to talk about. So we have recently hired a director of external affairs for Cal ICH. And I will let her introduce herself. But Erica Costa is our new director of external affairs, and she's going to be overseeing a lot of our communications and legislative work. So just wanted to give her a chance to introduce herself to this group, as she'll be a really important partner in a lot of the sort of external work that we do as an organization going forward. So Erica, would you like to introduce yourself?
Sure. Thanks for the introduction, Cody. Good afternoon, everyone. My name is Erica Costa. I am the new Director of External Affairs at Cal ICH. Previous to this role, I worked in the legislature in and around the Capitol community for a number of years. I did policy work in the building. I lobbied for a few years, and then most recently worked in a district office doing community engagement events and constituent casework. I'm happy to be here today, and over the course of the next few months, I'll be working on developing a strategy to strengthen our external affairs, our relationships with the legislature, state departments, and the public. And we'll be developing that, and also open to feedback and any ideas from folks as we move forward. So just happy to be here today, and great to meet you all.
Great, thanks, Erica. I appreciate it. So now I will move us on to our next agenda item. And I'll pass it over to Courtney Tacker, who is our Director of Policy and Innovation now at Cal ICH. And so I'll let her talk a little bit about the work that our Local Initiatives Division is doing, as it's very related to, I think, a lot of the work that you all do, and hopefully can provide some resources for the work at the local level. So Courtney, I will pass it to you.
All right, great. Thanks, Cody. Good afternoon, everyone. Happy to be with you all today. My name is Courtney Tacker, and I am the new Director of Policy and Innovation here at Cal ICH, as Cody shared. In this role, I'll be supporting the coordination and alignment of work within Cal ICH's policy, research, and local initiatives divisions. Prior to starting in this position, I served as Cal ICH's Director of Local Initiatives, leading the work within the Local Initiatives Division that's focused on identifying and sharing out best practices, developing resources, and working with local homelessness systems of care to implement strategies to prevent and end homelessness in California. For today's presentation, I'll be showcasing 2 projects from the Local Initiatives Division. My 2 goals for the presentation today are 1, gathering your feedback on how we can effectively advertise and spread awareness of these resources, and 2, asking how we can maximize engagement to ensure these resources are impactful for local communities. The projects I'll be discussing are iterative, and we look forward to continued engagement and feedback to further refine these resources so that they are the most helpful and beneficial for local communities. And with that, if we could advance to the next slide. So I'm going to first start with just a little bit of background on the role of Local Initiatives Division. The division strives to strengthen relationships and enable connections through the delivery of resources and information, the amplification of best practices, and acting as a conduit for communication across systems to support local communities prevent and end homelessness in California. Specific goals within the division include becoming a central resource hub for local jurisdictions to access and receive information, building relationships with COCs and local governments to identify needs and trends and support the development of future resources, amplifying successful strategies and best practices across the state by lifting up and sharing information through webinars, resource sheets, and other materials, and really serving as a connector across systems to support cross-system coordination at the local level. We could go to the next slide. So the Local Initiatives Division focuses on finding better ways to proactively share information to benefit communities. For example, the Cali CH newsletter was a big first step and is one outlet that we developed and used to communicate out information and resources. Becoming that centralized resource hub through the collection of resources and information in one central location is another way for Cali CH to share out information to benefit communities. In June of this year, the Local Initiatives Division relaunched our Cali CH's online resource library with a goal of creating a robust and user-friendly repository of resources. Using the resource library's filters and other organizational design features, users can easily find resources ranging from toolkits and guides and templates, webinars, and other materials that provide emerging, promising, and best practices to prevent and end homelessness from state, local, national, and other federal partners. The library is updated frequently and currently includes about 200 materials that can be easily searched by title, category, or keyword. The resource library is intended to really assist local leadership and partners in the homelessness response system in accessing evidence-based tools, promising and best practices from trusted and reliable sources that can be utilized towards preventing and ending homelessness within their communities across the state. Sources include federal partners such as National Alliance to End Homelessness, SAMHSA, and HUD. State council member department releases are also included in the library, and research bodies such as UCSF Benioff Homelessness and Housing Initiative as examples, among many others that are included there. In the design and development of the resource library, the Local Initiatives Division met with continuums of care, counties, and large cities to ensure the library was being arranged in a way that would be most useful to local leadership and inclusive of resources that would be of greatest benefit to those communities. The feedback that was received through these sessions was then incorporated into that final design of the library. Next slide, please. So on the screen here, you'll see just a snapshot of the Resource Library homepage. The library features a search bar where users can search for resources by key terms or phrases. The search functions can also filter by 15 different categories. These include cross-system collaboration and strategic planning, data and reporting, housing first, and encampments and unsheltered homelessness, just to name a few. Users can type or click a category of their choosing to populate all the available resources for that category. Each resource is tagged for all relevant categories within the 15 that are identified, so that these resources show up in all relevant topic areas. Within those 15 identified categories, a count is displayed next to each category to let the user know how many resources are available within that category. The search results can then be easily skimmed by title and description to locate the most relevant and beneficial resources. Staff within the Local Initiatives Division are regularly reviewing and adding to this list of resources within the library. Each resource added to the library includes the title of the publication or webinar, the authoring or releasing agency, year of publication, release or posting date, and the URL linking back to the source page for that resource. The displayed search results also includes a 1 to 2 sentence description of the resource so that users can easily skim for relevancy to the specific topic or item that they're looking for. And I'll just provide a recent example of how the resource library was used to support a local community. One of our partner departments was meeting with a grantee to discuss strategic spending of funds and specifically looking at best uses of operating subsidies. During the call, they were able to access and locate a resource in real time using our resource library and provide the community with information to support the strategic utilization of their funds. So we do hope to be a central location to house these materials, and I look forward to our discussion at the end of this presentation to hear more about how we can communicate and share these resources out effectively to make this page the most beneficial for local leadership. So I'm going to transition us to another initiative the Local Initiatives Division has been leading in collaboration with multiple council member departments. If we could now, looks like we already moved to the next slide. So the second project I'd like to discuss with you today is called the Homeless Emergency and Active Readiness Toolkit, or HART. And this toolkit was developed in collaboration with another acronym, Strategies, Tools, and Emergency Preparation for Unsheltered Populations, or STEP UP, which is an interdepartmental group across state departments led by Cal ICH. We can move to the next slide. So STEP UP was formed in response to the winter storms of January 2023 to support local jurisdictions in preparing and planning for future disasters and emergencies affecting people experiencing homelessness. STEP UP aims to underscore the critical role of an organized, collaborative, and responsive local disaster response to ensure the safety and stability of people living without shelter throughout California. The goals of the group include creating, streamlining, and disseminating information, guidance, and resources to support system leaders in advance of a disaster or emergency, developing and disseminating resources that assist local jurisdictions in preparing for and responding to disasters and emergencies impacting people experiencing homelessness, enhancing collaboration and coordination among stakeholders, and supporting the inclusion of people experiencing homelessness in emergency planning and response efforts. The STEP UP group is led by Cal ICH and includes representation from Cal OES, Department of Public Health, Department of Social Services, Caltrans, Department of Education, Department of Aging, and will be expanding to include Department of Housing and Community and Development soon. We can go to the next slide, please. To support these goals, STEP UP developed a toolkit aimed at assisting local emergency managers and city and county homelessness and housing department leadership and continuums of care by creating a shared understanding of the needs of people experiencing homelessness during a disaster or emergency, informing local partners of respective roles and capacities, supporting local interagency collaboration to create structures and resources for integrating people experiencing homelessness into disaster planning and response efforts, and providing strategies for supporting people experiencing homelessness during disasters and emergencies. Next slide, please. To create this toolkit, the team completed several information gathering activities. They conducted a review of information from a variety of resources, including HUD's Disaster Toolkit, resources from FEMA, Cal OES, SAMHSA, the National Alliance to End Homelessness, and many more. The team also integrated State Department information, such as the department's role during disasters and emergencies, resources and guidance they created, as well as their contact information. The team also reviewed 58 county emergency operation plans and annexes to better understand the inclusion of people experiencing homelessness in local plans. A survey was also distributed to California's continuums of care, counties and large cities to better understand current practices, identification of gaps in response efforts, and recommendations for supporting people experiencing homelessness in disaster and emergency planning and response efforts. The team also conducted interviews with 6 local jurisdictions to learn more about effective local practices to support people experiencing homelessness during disaster or emergency, as well as sought input and expertise from CalICH's Lived Experience Advisory Board in the formation of this toolkit. Next slide, please. So upon review of 58 county emergency operation plans, it was found that 28 of the plans did not refer to people experiencing homelessness at all in their plans. 30 emergency operation plans mentioned people experiencing homelessness. This was often a mention of the inclusion of this population, but did not include further information about how people experiencing homelessness would be supported during a disaster or emergency. There were a few plans that did provide exception to this, going into specific detail to support this population. Next slide, please. Of the 29 completed surveys that we received, survey respondents identified 3 specific actions that could be taken to improve coordination, including increasing collaboration, conducting joint training and exercises, and communicating clear roles and responsibilities. Respondents emphasized strengthening relationships across systems to address the needs of people experiencing homelessness during disasters and emergencies, including engaging people experiencing homelessness in planning and response efforts. Respondents also recommended that staff across the 2 systems participate in joint training and exercises to build trust, improve coordination, and prepare for future disasters and emergencies. And lastly, respondents recommended communicating clear roles and responsibilities to ensure everyone understands their role and provide cohesion during emergencies. Next slide, please. As part of this feedback, we also requested to partner with CalICH's Lived Experience Advisory Board to seek their insights and expertise in the formation and development of the toolkit. The discussion with LEAD members concentrated on strategies for engagement, accessibility, essential services, and transition to recovery. LEAD members identified specific concerns and actions for reflection and inclusion in the toolkit, and these included impacts of criminalization, building trust and rapport, partnerships and collaboration, access to information and training, communications, evacuation and transportation, shelter solutions. The group pointed out challenges such as communication issues in areas with limited Wi-Fi, the need for permanent housing solutions, and the unique challenges faced by people experiencing homelessness. Participants discussed ways to improve emergency preparedness and response for individuals experiencing homelessness. They emphasized the importance of cultural sensitivity, coordinated efforts among agencies, and access to basic facilities such as showers and laundry services. The importance of providing pre-employment preparation for people living unsheltered, expanding community health worker programs, and training for outreach workers was also stressed. So all of the feedback that was gathered through these many different engagements was then integrated into the design and the development of the toolkit. If we move to the next slide, I will just go over how that is structured. So the toolkit presents a 3-part approach to addressing the needs of people experiencing unsheltered homelessness during disaster and emergency, which is divided into those 3 sections that are showing on the screen, and they are be informed, get connected, and take action. Section 1, be informed, emphasizes the importance of understanding the emergency response system and the homelessness response system, and encourages readers to learn about their county's local emergency plan. Section 2, Get Connected, stresses the need for collaborative partnerships and the inclusion of people experiencing homelessness in emergency planning processes. It promotes a whole community approach that brings together all relevant partners to meet the needs of people experiencing unsheltered homelessness during disaster. And Section 3, Take Action, advocates for a proactive and comprehensive approach to address the specific needs of people experiencing homelessness during disasters and emergencies, focusing on communication, transportation, shelter, essential services, safety, equity, trauma-informed approaches, and transition to recovery. Next slide, please. So each section of the toolkit includes a key takeaway segment that's highlighting the major themes within that section. Each section also includes a tools and templates segment that provides various resources related to that section if the reader wants to dive further into the content that was shared within that section. Throughout the toolkit, there are also collaborative opportunities call-out boxes, highlighting examples of how different audiences can get involved and engage across systems, as well as exemplary practices call-out boxes, providing specific local community examples of the concepts that are discussed throughout the toolkit. And lastly, there are several appendices included in the toolkit that provide additional information and materials to further enhance understanding and implementation of the strategies that are being discussed. This includes checklists, contact lists, and other helpful information for the reader. Next slide, please. So we are close to releasing the final toolkit. We are estimating the launch date to be early December. To launch the toolkit, we're really focused on a marketing approach that supports connection of local homelessness response system leaders and local emergency managers to the toolkit. We will be releasing the toolkit in CalICH's monthly newsletter, as well as on our social media. CalICH is also working in coordination with our Step Up member departments to present the toolkit to various stakeholder groups, to share forward the toolkit and receive feedback and input on the creation of future resources that may be helpful in this space. We are also in the process of developing a webinar series that's aimed at introducing sections of the toolkit alongside exemplary practice highlights from local communities. So we are working in coordination with these communities to further share out the work that they're doing within this space to support people experiencing homelessness during disaster and emergency. And the division is also in the process of developing additional resources that came forward through the research and review phase of this process, such as the creation of a disaster preparedness specific funding guide and case studies highlighting the different exemplary practices that are also highlighted within the toolkit. Next slide, please. So Step Up is intended to be an ongoing interdepartmental work group. Members are currently in the process of finalizing additional activities for the remainder of this fiscal year through June 30, 2025. This may include developing things like quarterly bulletins that further expand on specific topic areas that are identified within the toolkit. Also looking at the possibility of developing or updating existing resources and other activities that will be finalized with this group shortly. We can move to the next slide. So I know that was a quick overview of these projects and brings us to the important part of this presentation, which is the discussion questions that we have for this agenda item. So would like to turn the remainder of the time back to all of you to hear how we can most effectively communicate out about the existence of these resources and really maximize engagement to ensure that these resources are impactful for local communities. So I've put a few discussion questions on the screen here just to get us started, but really look forward to any and all feedback that this group has. But just to get things started in hearing about these resources, how can we at Cal ICH most effectively communicate the existence of these resources to ensure that it's reaching its intended audiences? And really, are there specific outreach methods that might resonate well with our intended audience as well? So I will pass it back over to anyone who has feedback. And I see Reba's hand up.
I just go?
Go for it. Thank you.
No, thank you. Thank you for the presentation. There's a couple of things that came to mind. One is around language. And as I listened to the presentation, I realized the importance of clarifying and defining emergency, disaster preparedness. Now, I want to remind us that it's an emergency right now. I don't want to be harsh, but I think that it's really important to be honest about particularly language and how something is messaged. I became a bit emotional and got caught in my feelings as I was listening to because of the language and reference to emergency. People are dying on our streets every day. Just want to remind us of that, and then also ensuring that youth are, how is this messaging to youth, and is it the right type of messaging? Additionally, I have a lot of notes here that I wrote around this, and I'm looking forward to hearing from others, but I wanted to make sure I came out the gate with this about language and reminding us of language around emergency and how does California really, because there was nothing around ending this, but more about ensuring that people had information. So I look to really hear from others.
Yeah, no, thank you, Reba. I really appreciate those comments, and it's definitely important for us to take back and looking at how this information is being shared and really defining specifically the intention of the resource. And you also commented on youth and other specific groups, and we are hoping in future developments of this work that we can create additional and specific resources for various populations as well, such as youth. So I really thank you for those comments.
And I'll just jump in really briefly as well. And Reba, I feel like you're always good about bringing us to the person-centered conversation about this, so I really appreciate it. I think this is a good conversation to have around the action plan too, right? Because I feel like we have our like overall vision of like preventing and ending homelessness, and then within that we have all these different all this different work. So there's like the resources that Courtney's presenting about, right? And those are one tool within our set of actions. But I do think it's important, like you're saying, to ensure that we, are centering the ultimate goal of preventing and ending homelessness for folks at all times. So I appreciate that. I don't know if that answers your question fully, but also if you have a page worth of notes about this, I'm sure we'd be happy to talk with you after the meeting as well to get deeper into it.
Yeah, that would be great. Thank you. Turn it over to Jody.
So I think this is a super great start. As Reba said, like we could create a really big plan. I do think that in terms of pushing this out so that people have it, the obvious thing is that most people that that would be addressing what's in the toolkit are heavily engaged with COCs, HUD, as well as like the state funding agencies. Sorry about the dog. So I think like I don't know if the HUD Exchange would do it, but one thought would be to put it on there as a California, ask them to put it on their HUD Exchange, their info site as a California resource, as well as like all of the state funding agencies that their websites that we are all visiting very frequently. And then even a push out to the California PHAs, so the housing authorities, might make sense.
Great. Yeah, thank you. We would love to share this out as broadly as we can. So appreciate all of those suggestions.
I'm just gonna flag in the chat, Janet asked, did feedback include the lead voices from individuals and families who are in rural areas, indigenous communities, or persons with disabilities? I may have missed that in the presentation.
Yeah, so it's from our 11 members that currently sit on our Lived Experience Advisory Board, who are representative of many different experiences. So we did receive the perspective of those members. We do have some in rural areas, and we are, this first version is kind of a more of a intended to be an initial resource and higher level overview, but we would like to develop further iterations that may support, specifically looking further into rural communities, for example, and resources that can really be more specified. So I'll just provide that feedback if that's helpful.
I think it's also relevant to say, right, Courtney, that like this is, I think, as everyone's been saying here, like a good first step, but it is just that, like a first step. So if there are like groups, communities, populations, types of resources that you think would be helpful in this vein, I feel like we're really open and interested in hearing that feedback as well.
Yeah, Javon.
I don't know if HCD was listed on the group of collaborators, but also DHCS should be a part of this as well in regards to disseminating the information, but also partnership.
Thank you. Yeah, HCD is not currently a member. We're working with them to have membership on this group going forward. And we'll be doing outreach out to DHCS as well. And we're hoping to collaborate with all of our member departments to help in sharing this information out. So I appreciate that. I did just want to ask, I know we focused quite a bit on the toolkit itself and wanted to see if members here had any thoughts or recommendations also for just communicating out around the resource library itself, or how to really ensure that that's beneficial in supporting communities and being a resource for those individuals. Amelia.
Not to take us off on a tangent, but I'll offer something a little bit obscure. But when the term disaster preparedness and all of that came up, I mean, I was just thinking about actually the many disasters here that we have here in California, and the experience that we had when some of those natural disasters led to us coming in contact with people experiencing homelessness that were kind of hidden. But they came forward. The fires come to mind. We have fires here locally, and folks engaged with those disaster assistance centers. And those folks that were manning those facilities weren't necessarily home providers or housing providers. They were emergency response systems. And it would be great for them to have access to this toolkit, or to be able to figure out how they can then connect the dots for folks that are experiencing homelessness, because they traditionally don't deal with this particular, segment.
Yeah, no, thank you. That's really what we're hoping it accomplishes, and being a resource for both local emergency managers and leadership within the homelessness and housing space, and looking at how to prepare and plan and be more inclusive of the needs of people experiencing homelessness in those local planning efforts. So we're hoping that the information that's shared in there is beneficial in that way, and we'll definitely be including outreach and engagement with those local emergency managers for both release and inclusion in the webinars we hope to put on as well. Thank you. Joe. Joe, I see your hand if you're still there.
Yes, I was just going to say, any thought been given to podcasts as a means?
Do you have a suggestion of specific ones that would be good for our
Well,
population?
yeah, well, more so just in my own limited experience in doing all of that, you can get very creative, and it becomes very inclusionary if you get creative. And I think those are some of the goals, right, that are being emphasized here. So I just wanted to throw it out there, maybe just to give it some thought.
Yeah, it is. It's not something I have been presented with yet. So if you have other thoughts and ideas, like to share more about how you see that unfolding, I would love to hear about that.
Sure. At a different time, yeah.
You like
Yeah.
hearing us talk so much, you want us on a podcast, Joe?
Thanks, Cody.
Any other final thoughts or recommendations for us? As I mentioned, these are iterative projects. I would love to, continue to further develop and receive feedback from this group on how to make these the most beneficial and useful for communities. And if there aren't other thoughts right now, would love for folks to reach out to me and provide me with any other suggestions or recommendations that you have. Would be greatly appreciated.
Great. Oh, Mariah, sorry, go for it.
Hey, sorry, Cody. I did just want to ask if there was any way that tribal resource hub could be added to the section as well.
We would love to do that, and that is what we're looking at for future iterations of this work, to develop a more tribal specific resource. Definitely.
Wonderful, thank you.
Thank you.
All right, great. Any last thoughts, wishes for the local initiatives team? Oh, and I see Vivila's putting our current site for tribal resources and information, our current website where that lives. Great, okay, I will move us along to the next agenda item. So we can go to the next slide. Great. Very simple title, action plan. So you thought you had gotten out of hearing about the action plan, but here we are coming to you one more time with more information about our action plan. So just to set the stage here, we are in the final sort of leg of our work to put together a new version of our Cal ICH action plan. You all know this because we've been presenting to you about it for basically every meeting since we started a year and a half ago. But we are planning to present to, as I said earlier, to our council members at their meeting on December 3rd about the action plan, sort of the high level final version of it, and to get their input and talk through it with them and possibly put it up for adoption. So we wanted to come to you all to share that information with you about the plan as it stands today, with the caveat that in the next couple of weeks things might change slightly, but overall this is where we're at right now. Really to get your thoughts about like how do we, sort of similar to what Courtney was saying and relevant to the fact that we have a new director of external affairs, right? Like how do we make this plan not just a static document, but something that is actually useful and that is a resource for you all, is a tool that people refer back to, right? Is something that we can use as much and as actively as possible. So before we get into that discussion, I will share with you the details of the plan, so we can go to the next slide. So just a reminder about where we are in this timeline. So we actually started talking about the new plan about 1.5 years ago in September 2023, started having conversations to plan with you all and with the council, presented a draft structure to the council in December. And then in the first quarter of this calendar year, started public input, right? Started working with our lived experience advisory board and attending their monthly meetings to get their feedback on the plan, and to really work with them to develop certain pieces of the action plan. We put together, in response to our Cal ICH leadership's request, we put together goals to include as part of the plan, presented those to the council. Through April through August, we really were focused on public and tribal input. We did tribal listening sessions and formal tribal consultations on the plan, and I think it's 3 different in-person meetings and then multiple virtual meetings. We kept meeting with our lived experience advisory board. We started individual planning with our council agencies and departments, right, to get what all of the actions they wanted to include in the plan. We also had an additional council meeting to develop collaborative actions across departments and agencies, so that it wasn't just what is everyone doing in their own silos, but really have people talk and make plans together. And then most recently, and sort of where we're headed, right, is we finalized more or less our plan goals and the actions in those within the plan. And we plan to propose the new action plan to the council for adoption at their December 3rd meeting, and then really think through dissemination. How do we talk about this? How do we get this out there and make it a useful document? So that's sort of where we're at. We'll go to the next slide and I'll go over sort of the high level pieces of the plan. So you've seen this before, but just as a reminder, the vision for the plan for Cal ICH is an equitable and just California in which homelessness is rare, brief, and never more than a one-time experience. So pretty straightforward there. In the plan, we do lay out a little bit more detail underneath this vision, right? We talk about needing what an effective homelessness response system includes, right? Prevention, services for people experiencing unsheltered homelessness, access to safe housing-focused shelter and interim housing, and then access to permanent housing and permanent exits from homelessness. So those are all the things that sort of make up our vision. The next slide, we have our guiding principles. So there's detail to all of these, but what I want to highlight here, and you've seen a lot of these before, but what I want to highlight here is that these are not just principles, but they are sort of worded in our plan as commitments. So we think about the plan as something that our council members are agreeing to, right? And by adopting it, they agree to follow these or to work towards these guiding principles, right? So pursuing racial equity and justice, increasing access to resources for California's tribal communities, creating solutions for the full diversity of people experiencing homelessness, seeking and valuing the expertise of people with lived experiences of homelessness, strengthening housing first approaches, balancing crisis response, prevention and permanent housing solutions, advancing trauma-informed and person-centered services, and aligning health, housing, and homelessness strategies, right? So these are the things that we think without without tailoring our work in these ways, we will not successfully meet our vision, right? So we need to be thinking about these guiding principles and committed to these in order to successfully create a California in which homelessness is rare, brief, and one time. So in the plan, there was like a, language around each of these, what they mean, why they're important, and also like what a commitment to these looks like. So we'll go to the next slide. We also talk about how the plan includes racial equity throughout the various aspects of it, right? So there are multiple ways that we do this. For each of our goals, we have plans to report out on or disaggregate data. So we're not just going to report on like the overall goal, but we'll look at racial and ethnic breakdown of outcomes related to each of those goals, right? We also have integrated racial equity frameworks within the plan. So each of our action areas has an associated framework to help our state partners really think about designing and implementing programs in a way that centers racial equity. Our racial equity working group has, looked at these frameworks, and they're becoming, they're developing their expertise in how to apply these to state level programs, right? So that our state partners, similarly with our lived experience advisory board, can come to our racial equity working group and say, hey, we're designing this program. Can you help us take a look at it and make sure that we're centering equity in the design or in the implementation or in the measurement, et cetera. So as I said before, right, ensuring we're also looking at collecting and analyzing data, involving communities in planning and decision-making throughout actions in this plan, providing training and technical assistance to our partners, and increasing resources equitably. And then there's just a note here again about the Racial Equity Working Group. Oh, it's called the Racial Equity Implementation Hub. Sorry, I forgot about that. Launching their implementation hub to help really be a resource, a state level resource to our partners to understand how to develop their policies so that we're not just, crossing our fingers and hoping that equity gets addressed, but really intentionally centering racial equity in what we do so that we know that we are addressing it from the start. So on the next slide, we'll talk about our 3-year goals. So the way we've talked about this now is we have a sort of what our North Stars, right? So where are we aiming toward with this plan? What is it that we are hoping to achieve? That's related to our vision. But with these goals, right, our overall North Star is that in an ideal world, right, with all the resources available and all the systems, working together, we would have a housing placement available for every person that we serve in our homelessness response system. Currently, when we look at our data at the state level, at least through HGIS, we see that about 1 in 5 people served exit to permanent housing. So about 20% of people served every year are exiting to permanent housing. And so for our 3-year goal, so for the goal of the plan, right, the plan is between 2025, 2026, and 2027. We were asked to set bold, measurable goals. And so our 3-year goal is to cut that in half, right? Or double it as you were. So for every 2 or 3 people served, one is placed in housing during that year. And this is like, right, this is where we're aiming towards, right? This is what we're trying to achieve. Our council members wanted to set bold goals so that we could be pushing ourselves in the direction that we want to see the state go. And so underneath this sort of overall North Star, right, we have 5 individual goals with North Stars listed for each of those goals. And everything is structured such that by 2027, the end of this plan, we are stating that we would like to get halfway to all of our sort of North Stars in each of those. So there's also a focus within each of the goals on addressing profound racial inequities and other disparities that we were talking about, right? As you saw in the data on that last slide, communities identifying as Black or African American, Native American, American Indian, or Alaska Native, and Native Hawaiian or other Pacific Islander communities experience disproportionate experiences of homelessness compared to their representation in the population overall. We also know that there's a lot of issues with data and actually even seeing who is experiencing homelessness in those communities and in other communities, which the plan talks about a little bit. And so with our annual performance measurement on these goals, we do plan to have, detailed demographic analysis there. So now I'll move into what the individual goals are. And so again, I haven't listed out here sort of all the North Stars and everything for each of these goals, but those will be in the plan. But the 3-year goals are listed here. And I think before we send this out, I can add some bullet points on the side here about the baseline data that we have for each of these, because that's sort of how we got to these. But for Create More Housing, that's our first goal. This is really connected to the HCD statewide housing plan. And their overall goal by 2030 or so is to permit more than 2.5 million homes. And so their 2027 portion of that is to permit more than 1.5 million homes, with no less than 710,000 of those meeting the needs of low and very low income households. We know this is really, in many ways, somewhat of a prevention strategy, right? This is a supply strategy. This is really focused on increasing the supply of housing so that people aren't falling into homelessness. And, as we look at the data for this goal, we will break it down by, low and very low income households, but also can we identify people experiencing homelessness who may have had access to these units, right? And how much did that affect their ability to access housing? Goal number 2 is helping more people leave unsheltered homelessness. So currently, the percent of people who leave unsheltered homelessness and enter either emergency shelter, transitional housing, or permanent housing was around 42% in 2023. The goal here is to increase that. Let me say the North Star is everyone who experiences unsheltered homelessness can enter one of those sheltered settings. And so about halfway there is getting us to 70%, right? So we would hope to see that at least 70% of people experiencing unsheltered homelessness can enter one of those sheltered settings. Goal number 3 is help more people move into housing. So increase the percentage of people who move into permanent housing. Right now, I said that was 20%. Obviously, our ultimate goal, as you heard, was getting that to everyone who we serve can move into permanent housing. And so we want to increase that in the 3-year timeframe from 20% to 60%. Goal number 4 is around improving connections to health and social services. So this really comes from our work doing. So we've been in the process and are just finalizing some data sharing with our partners at HHS, right? So the Health and Human Services Agency, so that they can utilize our HGIS data and compare it to the data that they have on health services across the state. So we don't have the baseline data yet because that is just in progress. But ultimately the goal will be around increasing the percent of individuals or families that are experiencing homelessness who are enrolled in and receiving Medi-Cal and CalWORKs. Excuse me. And I will pause in a second. And last but not least, so we want to ensure that people do not experience homelessness again. So currently, I believe our baseline data shows that 91% of the people who move into permanent housing in the state do not experience homelessness again within 6 months. So we want to increase that to at least 96%, if not more. So we want to make sure people are staying in their housing. So I see a couple hands. I do have some more slides about the plan. I'm happy to pause and answer questions now if folks have questions, or wait until the end, whatever you all think would be most effective.
Hi, Cody. Maybe I could just give a quick comment. Thank you so much for going through these. Just on this slide specifically. I do feel like on the first one, low and very low income households, I know that that's, probably based on like housing elements. These are not the households that are most at risk of homelessness. And so wondering if there's any possibility for, making sure that we're really targeting housing for people who are like within the extremely low or even acutely low, especially given the results of like the CASPA study showing people are usually like within the acutely low income category. And people who are on SSI, disabled or older adults, are increasingly falling into homelessness because their incomes on SSI are just not able to keep up with rent. So just keeping all of that in mind, for number one, it seems like that goal is not going to really have much of an impact on homelessness or who's falling into homelessness. And then on the last one, I mean, could comment on each of these, but on the last one, again, just 6 months is not very ambitious. And so I know a lot of the plan is ambitious, and I would love to see this moved from 6 months to, a longer term goal, like 2 years would probably be, a little bit more, looking far reaching or looking forward rather than kind of thinking about what people are achieving now. Thanks for pausing there.
Yeah, no, that's great. Thank you, Sharon. I appreciate those comments. So I think on the first point on the Create More Housing one, so I think actually this might be it's possible that I just didn't update this. I think that the very low income, I think we will be breaking down this goal by the two categories that you said also. So while you're right, this does come from the housing element work. So while it's not necessarily changing exactly how many units are being permitted right there, it'll at least show us what the breakdown is and help us understand like what percent of these units are really directly impacting people that are experiencing homelessness now. So I do think that we will be able to see that in the data. For the goal number 5, that's really helpful feedback. I think we went back and forth around whether to use 6 months or a year. I think it's something that we're still looking at. I think we ended up with 6 months just because the reporting period gets tricky as you sort of start overlapping multiple years in our data, but it's something something that we can look into and see if there's possibility to sort of like not only look at 6 months, but look at a year, look at 2 years, right? And really show, how people are moving through the system over the course of that time. So that's something that we can take into consideration for sure.
Thanks, Cody.
Yeah. Alex, I see your hand.
Yeah, just something to consider there. I ditto everything Sharon said and agree that given the way many programs are structured, like given the way rapid rehousing is structured, that 6 months I don't think would be long enough to really give you a good indicator. I know in LA County, as they're developing goals for the new revenue measure that just passed, Measure A, one of the things they're looking at for housing retention is having like kind of dual measures, like a short-term measure of retention for that particular year that they're in, as well as like a 2-year kind of look back measure as well. So I think that's something to consider is that you don't have to have it just be like one metric to measure this goal. You can have 2 metrics that look at an immediate period and a longer look back.
That's great. Thank you, Alex. And yeah, I will say under each of these, something I didn't say was under each of these goals, there are potential sort of like metrics, like sub measures in some ways that as we're going back in a year to sort of understand performance and do performance measurement, that we would sort of disaggregate some of these goals in different ways. And I think that makes sense to have sort of a look back if we can. So yeah, thank you both for that. Reba, I see your hand.
Yeah, thank you, Alex and Sharon. Number 4, I'm curious about what's the current percentage at this particular moment on number 4. And then on number 5, one of my favorite words is ensure. I love that word. Favorite word of mine. And so I'm curious, what is the action or what is the plan to ensure? Because when you use that word, it's a promise. It's a promise for me. And it says that we're going to do something. So what is the action to ensure? that. And then I also strongly agree, and I would say 5 years, not 2 years. But then that also means that there are some essential services that are connected to individuals and support to ensure that they are able to retain their housing. So if you could tell me the percentage currently for number 4, and then how you plan to ensure.
Yes, great. Thank you, Reba. So for number 4, we don't have a percentage at this moment. And the reason for that is this requires 2 different data sets to come together and be sort of compared. So our HDIS data as compared with data from the Health and Human Services Agency. And that work has not yet been completed, right? To really connect those 2 databases, although it is like very much actively in progress. So I think our plan is to update the action plan as soon as we have some of that baseline data, Reba, that you're looking for, and really use the baseline, like what are the percentages now to help us define a goal. So that's to your first question. The second question that you had around Ensure, I think that's sort of right what the plan tries to get at in a way. Is our hope is that the actions that are within the plan are saying, hey, this is the work we're doing to lead us to our goals. And there might be, I'm going to go out on a limb and say there are likely more things we need to do in order to meet the wish that is, or the commitment that is the word ensure. And I think that's where the plan becomes very useful, I think, is to say, okay, here's the goals, here's what we're saying we want to do. Here are the actions. Here's what we're saying we currently do. Is there a gap between those, right? Is what we're doing enough to actually ensure people are not experiencing homelessness again within this certain time frame? So I feel like that's sort of the work that we're saying, here's what we're doing in the plan, but also the work to follow up on the plan to say, in implementing it, what are we seeing that's not happening, that is happening, that's effective, right? Et cetera, et cetera. So I'm sorry to answer your question with more questions in some ways, but does that make sense? No.
Okay, go.
But okay. Sam, I see your hand.
Hey, Cody, thanks. I want to second the previous commenters, both on the duration of time, like the 6 months not being quite long enough. And I really emphasize the number 1, the depth of affordability is super important. I am struggling conceptually with the measure for number 2. Is that like the percent of people who have been touched by outreach who then enter into that? Or because we don't have a real-time measure of unsheltered homelessness from which to measure that. So it seems like something that's heavily dependent on the number of people being touched by outreach and entered into HMIS.
Yep, great question, Sam. So all of the HDIS data, right, as a reminder, is around service utilization. So as you all know, right, we can only measure within HDIS, at least, the only measurements we have are who is interacting with the homelessness response system. And so this is, and I think maybe we word it slightly differently, but really this is the percent of people who interact with our homelessness response system, right? And that could be via outreach, that could be you're in and out of shelter, that could be, a number of things, right? Where we have said, oh, we've identified that this person is experiencing unsheltered homelessness, right? They're living outside in some capacity. And we have then seen that they're like where they are was started out being unsheltered and is now in a shelter, right? So I think what you're getting at, which is a really important caveat to this, is we don't have any measurement of the folks that do not interact with this system. So this is not meant to be a like, here's the total number of people experiencing unsheltered homelessness detail, right? This is really, here's who we know is interacting with the system and engaging with services in that way, in a way that gets them into HMIS, right? Who we can see their prior living situation is unsheltered. Any other questions? Oh, Megan, I see your hand.
Hi.
Hi.
Gosh, it's been hard for me to figure out. I can't figure out how to get my video to work right now. To that point though, Cody, I'm still stuck on on number 2, if you're leaving unsheltered homelessness,
Uh-oh, you muted Megan. I don't know if that was intentional.
okay, I think I'm unmuted again. Sorry.
Yeah, you are. No,
Okay.
you're good.
So I don't know when I cut myself off. Where are the, so, right, this is, do you mean within the year on increasing the percent of people who leave unsheltered homelessness? Because, okay,
Yes.
because if you're
Sorry.
leaving unsheltered homelessness, you're going somewhere. And if
Yep.
you're, unless you're dying or going to jail, you would be going to one of these locations if you're leaving unsheltered homelessness. So I do think it needs some clarification there.
Yep. No, it is annually, so that's a good clarification for us. And it's also, right, like we can also measure, even if the interaction with the system starts when you enter shelter, right? If you have listed that your prior living situation was unsheltered, we can include that in here, right? So it is annually, and we will be able to include those folks.
Okay.
Let's see. Oh yeah. Does that make sense, Megan?
No, but I trust that you'll eventually make it clear to everybody else. So it's okay if it's not. It doesn't make sense as it's written, but maybe you'll get there. I mean, if you're leaving unsheltered homelessness, I mean, I guess you're saying if you were unsheltered during the year, you want 42% of those people who are unsheltered during the year to enter one of these places at your moment that you're counting them.
Yeah.
Okay.
Yeah, so it's not like enter those places necessarily as opposed to entering other places. It's really leaving unsheltered. It's trying to measure like how many people are leaving unsheltered homelessness.
You want to increase the percent of number of people who leave unsheltered homelessness in a positive way, not in a negative way. Like a positive way, meaning not dead or not in jail.
Yes.
From 42% to 72%.
Yeah.
Okay.
Great. These questions are extremely helpful for me. Thank you, everyone. Al, I see your hand.
Yes. Yeah. Hi. Hey, Cody. So on number 4, I understand that that's going to be difficult to get those percentages because that has to be data feeds from different areas. But can you add, or can we add in sub goals? Like for instance, of the individuals that you're helping leave unsheltered homelessness or who leave unsheltered homelessness and enter into emergency shelter, transitional housing, or permanent, you know what that universe is. Couldn't you say that 95% of those individuals connected to those systems would be connected to medical services or CalWorks? Same thing with these other objectives that what the defined population is. I hope I'm making myself clear.
No, that's a really interesting idea. That does make sense. Yeah, I see what you're saying. You're basically saying like utilize the number of people, like the world of people that we have in the HGIS data and set a percent goal of those people to have access to Medi-Cal and CalWorks services. Yeah, I think that does make sense. I think we haven't written a specific percentage yet because we've been basing these other ones off of the baseline data that we were looking at. But I do think what you're saying is sort of like where we're headed, right? Once we have that baseline data. But ultimately, yes, it's like we're using the world of people that we see in HGIS And we're saying of those people, we're gonna want a certain percentage to, who are, you know, eligible for those programs to have access to them. So yeah, that's definitely right. We could set something now. I think we wanted it to be connected to the existing data.
I think a better matrix really, or I don't know if it's better or not, but I think it's important to make sure that folks that are interfacing with the emergency shelters, the transitional, the permanent, that you have connections to and information for, that may have case managers and such, be connected to these services, because it's been, you know, our experience just as an organization that sort of does housing and health, that people seem to do better when they have an opportunity to avail themselves of the social services, Medi-Cal, CalWORKS types of things when they're in those systems. So, you know, I would figure out some way to connect it. Thank you.
That's great. Thank you, Al. I really appreciate that. Reba, I see your hand.
We go back to this slide that talked about racial equity.
Yes, we can. I think that was the last slide before this one. Or maybe 2 slides ago. Oh, one more. Yeah, there you go.
So, you know, it's interesting because when I'm looking at the goals, I'm trying to see how does this all fall in. And so there's a couple of things. One is there was one slide where you mentioned 2027. Where's that slide? Mentioned.
So 2027 is sort of like the end date of the plan.
Of the plan, right. And
yeah, yeah.
But it's interesting because in 2026, our governor will no longer be our governor. He'll term out, right?
Yeah, yep.
So I'm leaning into having a somewhat of an uncomfortable conversation.
Sure, please.
And so how do we ensure, my favorite word, that this beat continues, no matter who, you know, is at the helm? And then I want you to, that's one question, because we're planning something on our North Star for 2027, but there's no guarantee here. And so if you go to the next slide around the racial equity piece, I think, you know, here's an opportunity right now while we are, you know, making these plans to actually move on these, particularly around racial equity. I know I've been talking about it for 10 years. We sat at a table here in Los Angeles in 2018, and we talked about it. In 2019, we launched a report called the Ad Hoc Committee on Black People Experiencing Homelessness. Here we are 6 years later, and guess what? Did you hear me whisper? I don't see nothing. And so I just need to say, uncomfortably, how tired I am having a conversation or uplifting about something that just doesn't seem to happen. So is it possible that we can more demand that things are happening from the state level? Or how strong can our governor go in order to make sure that this stuff starts to happen right now? We don't need to wait to continue talking about a plan or create a plan. It's necessary right now. Right now. In 2027, we don't even know if we're going to still be sitting around this table. And so I am losing hope, unfortunately, but I need to tell the truth. So the question is, what can we do now and not so much look at the goal being 2027, but what can we do for 2025?
Yeah, thank you, Reba. I feel like this is something that we contend with a lot, which is like plans are plans are plans are plans are plans, right? And that's all well and good, but the point is to create a plan that gets used to make actual change happen. And I imagine that the more plans you've been a part of creating, the more frustrating it feels to make more plans. So I hear that, and I don't know that I have an answer to it necessarily. I will say, as far as like the work on the equity goes, right? I think you asked like, what is it that we're doing now, not just looking to 2027. The goal here is not to say, oh, we'll come back to this in 2027 and see how we did, right? The goal is to use this as a guide for our work with state departments and agencies, right? So to say, hey, we have these goals, what are we doing right now to work toward them? And then, you know, every year we're going to look at the data, but it's not to say that there isn't work happening between those years, right? Like our racial equity working group is right now working on being able to provide sort of technical assistance to state departments and agencies on the development and implementation of their programs, right? So that's something that they've been working on. They're actively working on right now, and will be able to help with once this plan sort of goes into action. I think this is a way for us to say, you know, potentially in ways that we haven't necessarily before, or in a way that we haven't said specifically related to homelessness as a state, like these are the things that are important to us. Like it's important to us that we not only prevent and end homelessness, but by doing so, we have to focus on the people that are most disproportionately affected. And we know who they are, right? The data's not new. So I don't have an answer to all of your questions as usual, because you ask really good, big questions and I don't always have the answers to them. But I think our hope is that by publishing this, right, by putting this out there, this is what helps us continue to beat the drum, like you said. And this is sort of the motivating factor that helps keep us moving on this work. When we know that there's going to be a lot that's going on at the state, at the federal level, you know, whatever, wherever it may be, that is attempting to distract, right? We hope that this is sort of an anchor in some ways.
If you don't mind, if you
Please.
stay there on that slide. I just want to bring, you know, to all of our attention, you know, the numbers here, this data on Black African Americans. And in California, this just remains to be the same. But no one seems to really talk about how Black people are disappearing. Now, even here in Los Angeles County, when we launched the ad hoc committee report, we were 9% of the population. We're 7.6. The reason I'm stressing this is because we have to do something, and the time is now. You know, I don't know what that looks like, but I'm encouraging those of you who are around this table who can do something, do something. Something has to change, and we can't keep talking about planning it. What is it that we can do right now based on what we're looking at? It's right in front of us. And it remains in front of us, and it never changes. And then we act as if we can just keep talking about it. And I just need to say that.
Yeah, thank you, Reba. I just want us to all like sit with that, because I do think that that's really important. And I appreciate your saying it here. I hope we can find opportunities for you to say it in other places too, in other situations, right? So it's not just this group hearing you say that, but I do think it's really important to lift up. And there is in the plan sort of a discussion, and we'll send it out and make it public to folks, the draft that was sent to the council, but there is really a clear discussion and statement in this particular section around leading with equity, right? That says, if we do not put the proper resources into addressing equity, like nothing's going to happen, right? Like this is just another plan. And so I do think we try to recognize that in the way we talk about this, but I definitely hear you. I saw another hand come up, but it's not up anymore. So I will keep us moving. I really appreciate folks' comments. This is really helpful to get your thoughts on all of this. So let's go to the next slide. I think we only have a few more slides left. So yeah, we'll stop here. So one thing that's different in this plan than it has been in the past, and I don't think that you've seen this slide yet, is there was a real desire to say, okay, you have these goals, but what are you doing, right? What are the investments that have been put in that are going to lead to the achievement of those goals, right? So this is a sample of a table that is very, very long in the plan currently. And it lists, we basically went through all of the work of our council departments and agencies and pulled out what are like literal funding or literal programs that they implement. And how do they drive progress towards our goals, right? So not every single program will hit every single goal, some will. I actually am looking at this slide right now and realizing that I changed the program names on the side there and did not change the check marks. So you are seeing the wrong version of these, apologies, but there will be a correct one in the plan. All right, so for example, how does HomeKey that HCD implements, HomeKey Plus, how is that going to help us reach our goals, right? Like it helps create units, it helps move people into housing. In some ways it will help connect people to services, right? So for every single program or investment that the state has made or implements, where do we see those touching our goals? And then in the future, right, coming back and saying, okay, let's look at the outcomes from these programs, right? Like how many units were created, how many people experiencing unsheltered homelessness moved into shelter through this program, right? And some of that we can do in HCIS. Some of that we're going to need to go out and figure out how to measure for all the different programs. But this is something that our leadership really wanted to be able to say, like, okay, we have these goals, but it's not just enough to have goals, right? We have to show what are the actual pieces of work that are leading towards those goals. So this is a sample of that. As I mentioned, it is now an incorrect sample, but a sample nonetheless, it's just to give you the general vibe of what it will look like. And I would say there are a lot more programs listed here. So it is a relatively sort of long list, but the idea is to give the public and to give the state and our state partners, right, information about how we see all the pieces of the puzzle fitting together to work towards our goals. So that's the idea here. And then I'll keep going through the slides because we're almost there. And then we'll open it up for questions again. But the 5 action areas you've seen. So after the investments, we're talking about action. So not necessarily like implementing HAP or HomeKey, right? That would be an investment. But this is really what is all the other work that we need to do in order to make those programs more effective, right? This is increasing people's access to housing and services. This is coordinating and streamlining state programs. This is engaging our partners and community groups. This is using data strategically, right? This is advancing best practices and quality. So this is all of the other work that's happening at the state level. There's a bunch of it. I think, again, the idea is to give folks a sense of like here, and then each of those actions, right, is connected to one or more of our goals. The measurement will not be exactly the same because these are not necessarily things that you can say like, you know, data sharing increased coordination and then led to a number of units created, right? But it's still a really important set of work. So this is going to be sort of another bulk of the plan, right? Here's the work that's inducing us to get to our goals, right? The work that is really helping make those investments effective. And how it also shows who's collaborating on this work, right? So it shows who's leading the actions, who else is working on it, right? How are they working together? And wherever we found sort of like duplicative work, we try to put people in conversation so that we can say, hey, you're both doing this, right? Or you're doing really similar work or complementary work. This is a way of sort of getting our departments and agencies to talk to each other. So those are the actions. And then the last slide, I believe that we have is around, the next slide is our implementation plan. So yeah, perfect. And this is not the most fun slide to look at, so I will summarize it quickly, right? But there's going to be a section on all of the different things that we plan to do to implement the action plan, right? So regular and transparent performance measurement with annual reports on metrics for the investments and towards the goals, including disaggregating around racial disparities. We want to focus on addressing inequities, right? Ensuring programs now, like we were talking about before, are designed and implemented to address inequities with support from the Racial Equity Working Group and our Lived Experience Advisory Board. We're going to help coordinate across council departments and agencies. So, hey, we all said we're doing all this work. Let's make sure that we're connecting on complementary or parallel work and following up. And Cal ICH can act as sort of a bridge between departments and agencies. Collaborating with our external partners, so including you all, but also the legislature, state level advocacy, right, tribal governments, with like trying to help pull out information in the plan that's going to be useful in their work. And then public education and awareness, right, communicating broadly about the new plan. And then, you know, refining the plan for the future after, once we're towards the end of the plan, how do we want to refine, build on this, right? As Reba mentioned, we're going to have a new administration. How do we keep the work going in a way that we think is effective? So those are the high level, that's sort of like the high level outline of the plan. I know we got into it around the goals, but I know there's also a lot of other elements of the plan. Does anyone have questions about that? The discussion questions here were really focused around like, how do we make this useful for people outside of Cal ICH? And our departments and agencies, right? But open to any questions or thoughts you might have in other spheres too. Yeah, Ludmilla.
Quick clarity question here.
Yeah.
The previous slide, you said after 3 years, after the third year, is that after the third year from today or after the third year from some other date? Or
good question. The plan is a 3-year plan. So probably somewhere within the third year of the plan, we'll want to start thinking about, you know, thinking about how do we continue it past the 3-year marker, right? So sometime during 2027, I would say.
Okay, got it.
Yep.
Maybe putting a date in there would help us remember 3 years from now, or 2.5 years from now when when we're supposed to do that.
That's a good idea. Yeah, Alex, I see your hand.
Thanks, Cody. So much exciting stuff in the plan, and I think, you know, Reba mentioned it, you've mentioned it now, you know, the incoming federal administration, right, has a stated federal approach that I think runs directly counter to a lot of the principles that are stated as guiding principles of the plan. So given that this is being discussed by the council in December, before that administration comes in, it feels like it's going to behoove us to hear from that council as to like not only what is being done to like promote the plan, but what's being done to defend against things that could just totally wreck so many elements of this plan and so many elements just of homelessness policy and what we're doing in California generally, right? And so like a few things come to mind that, you know, feels like, how are we protecting, reinforcing housing first, right? Which is the driver of what works in California. How are we going to protect people's data in HDIS and local HMIS systems, including any data that might be floating around in there about documentation? How are we going to work to protect against cities kind of leaning in and working with the administration on any plans to create, you know, what are essentially internment camps, which is something the president-elect has spoken about. what are we doing, to make sure we're rooting efforts in racial equity, right? Knowing that the administration is speaking very bluntly and about, wanting to disband any things having to do with DEI, having to do with a focus on racial equity. How are we protecting the rights of trans folks experiencing homelessness? So it just strikes me as like there's this whole new, well, it's not new, but this whole world of policy defense we need to think about as a state. And so the time to talk about that, to Reva's point, feels like now, not after the administration has come in and starts, rooting around. So just hoping that can be brought to the council and that can be a focus of the council's conversation.
Yeah, that's a very good idea, Alex. And I think that's something that I do want to spend some time with the council on. Because I think, we'll obviously they'll be able to ask questions about this and workshop smaller pieces of it as necessary. But I really do think the majority of the conversation I'm hoping to have is around implementation, right? And so I think that is a big question on implementation, is like, how does the federal environment affect what our plans are that we've all put together in this? And not only that, but how do we, like you said, sort of like defend our work when there are things happening outside of our control that might try to push it in one direction or another. So yeah, do other folks, just to pause, I know Javon, I see your hand, but do other folks have thoughts on that? On what you'd like to hear from the council on that in any way as it relates to this plan? Yeah, Ludmilla, I see your hand up.
Okay, I don't want to bypass Jevon if he wants to go, but did you want to hear from me first?
Yes.
Okay.
Great.
Okay, so yeah, and I'm gonna say, are there any? I'm so glad. Well, glad isn't the word, but I'm so thankful to hear people raising these extremely difficult and extremely relevant issues, and that I do agree with. Question: are there any parts of our homeless resolution plan that might be in alignment with the new government, the new federal situation coming in? So are there things that we can say, oh yeah, this parallels what they would do. This has strengths. Is there anything that we could express in terms of the needs or strategies of that would align with their strategies, so that we can kind of highlight and strengthen those? I'm just because of our whole thing is saying all of what we're doing is against all of what you're doing, that's going to be a very difficult stance to maintain. Yeah, anyways, and I will say that I really feel that things that we can implement locally are going to be the strongest and most effective going forward, because part of the problem is that these things aren't on the ground where they need to be and be most effective. I mean, they're not. So coming from the top down is kind of difficult systemically, given the new federal climate, and it's been difficult all along. Is there anything that can be done to have it come from the ground up, to have anybody who wants to recover from homelessness be included in doing something, helping something? I don't. Words kind of fail me given the magnitude of what we're looking at, but I'm thinking hard here.
Yeah, thank you, Ludmilla. I truly appreciate your question, and I appreciate you asked it, because I have not thought about what pieces of our work are potentially aligned with what might happen in the federal government. I don't know if I can predict, or many of us can predict, but I hear your desire to have sort of like here's where we think things may overlap in a way that could be useful to push our own agenda, right? Or push our own priorities. And then as far as, focusing on the ground up, right? You know, we engage with our lived experience advisory board, so I'm sure we will continue to do that in this work as well. But always good to think about more opportunities to engage people with lived experience or people who have experienced these various issues that we're talking about. And then I saw Javon had a hand. It's possible he had, oh no, there's Javon, I see. Yeah, Javon.
Yes. On the action plan, action area 2,
Yeah,
the number 6 goal, with the encampments, I'd like to have more data on that. As we know, the Supreme Court has threw that wrench. And then here in California, the encampment dismantlement, which was supposed to be policy at first, but communities have taken that and they're sweeping. So if we can get some info on that, because that is again dismantling and displacing a lot of people, especially people of color, Black, African American, African folks. So we make up majority of that population. So I need more on that. When it comes to the HIP CDE data, I would like to know how that went down because that money is now done. And I would also like to know the graduation rates, because when it comes to young people, if they do not have a high school diploma, they are at increased rates of experiencing homelessness. That could also be transferred to the families and the children that has been impacted, because we know that if a child has experienced homelessness in a family, their risk increase of experiencing homelessness later in their future. So that is way upstream. That is getting to the prevention as part of this plan. And then also just a thought, as the current California administration, Gavin Newsom has, you know, we're supposed to be going all electric in 2035. Let's figure out how we can do something in regards to homelessness and give it that extension that it needs, and using whatever strategy that was used there or what strategy can be used specifically for this, because as Reba said, it's real in 2026, and we have all of these plans that are supposed to be doing the work. Great innovations, by the way. It is lifting some people out, but we know that we got a bombshell that we have to deal with, and plans is only a plan unless it's executed. And right now we have opportunities, but we need more.
yeah. Thank you, Javon. I'm not gonna hit everything that you said, but I will say, including sort of CDE level or like education data in our metrics is something that I do want to do. So I really appreciate that call out. We do in the plan talk about the difference between sort of our data and the data, like the sort of McKinney-Vento data that CDE collects. So there was a discussion of that in there. And
one more thing, point in time
Yeah.
counts. It's supposed to be coming out. It's not talked about. I think it was talked about like 3 times in the whole action report. But point in time data is about to be, what's that word? Kerfuffle? Is that the right word to use?
Yeah,
It's
that's
about to
right.
be all over the place. So HUD, our data, that's how our money gets distributed throughout the state of California. So that point in time is about to come up in January. Not sure how that's going to impact the overall funding and all of that stuff moving forward. So also wanted to throw that out there.
Yeah, awesome. Thank you, Javon. Okay, we have time. All right, Lumila, I'll give you sort of the last word.
This is
Oh.
this is going to be short. Okay.
Okay.
One big thing, and thank you, Javon. You just reminded me of there's an issue with some places, and I'm not sure where all this is happening. Taking things like RVs and stuff like that, and trying to get a code enforcement to declare that they are unsafe and stuff like that, so that they will fall under the governor's executive order for sweeps, so that the people can be removed from their you know, RVs or trailers or whatever. So they're basically things where people are relatively safe at this point. They're trying to get them declared under code enforcement unsafe so people can be removed and then pushed into a system which is already, as we know, overloaded. You know, so if there's any way to stop that kind of nonsense, that will really help it'll largely help the people who are somewhat capable, you know, are already on a stepping stone up toward out of homelessness, and I don't want to make it impossible for them to move on, you know, be safe and move on up.
Yeah, thank you, Ludmilla. I appreciate you calling that out. Okay, I know we're almost at time, and I think we could talk about this a lot. If you all have other, I saw some comments in the chat around presenting the plan to faith-based networks and regional convenings. So yeah, I think we will think about how do we share that this is a thing, that this is a plan, after it's sort of put out there. So appreciate that. I see comments about planning for the future with the new administration. So yeah, definitely see those. And just really appreciate, I know we've really talked to you a lot about this throughout the process, and you all have provided us with a lot of thoughts. And I think sometimes it may have felt like repetitive, or you were like, you're coming back to us with this same thing over and over again, but I do think it made this work a lot stronger and will continue to do so. So I just want to thank all of you for your time and attention to this. So with that, I'm going to move us along to public comment. So I will pass it to Claire to facilitate public comment.
All right, thank you, Cody. So we will now accept general public comments. We welcome all comments and feedback. Due to the structure of this public meeting, we will not be able to respond to any questions. So if you have any questions for CalICH or the advisory committee, please email us at calich@bcsh.ca.gov. Everyone will get 2 minutes for their comment. A CalICH staff member will soon share their screen with a 2-minute countdown timer, and we will warn you when your time has expired. If you are connected through Zoom, please select the raised hand icon in your meeting window. And for those joining by telephone, you may press *9 to indicate that you would like to comment. And once I call on you to comment, you will press *6 to unmute yourself. Okay, so I see a few hands. So the first one is a phone number ending in 3713. Please go ahead and voice your comment.
Hi, this is Ruthless. I heard when you said about HomeKey creating units. Like, I don't think HomeKey has created a single unit. Like, these units existed. We lived in them. We used to rent them from our neighbors, the owners. They were usually immigrants, and it's changed ownership now to nonprofit CEOs that keep them vacant for years at a time. It's done the opposite of create units. It's made units that we used to be able to access inaccessible. A lot of the units that were purchased were rent-controlled units that were protected under LAMC Section 4117, which was supposed to protect almost 20,000 units in the city from demolition and keep their rents affordable to very low-income individuals and families. And now we have, more than 1,000 units that are owned by nonprofits or the city's housing authority, and they're vacant. And they are like there's this one that was supposed to open after like 2 or 3 years, and it's not even opening now until next year. And I just helped a lady this morning who's being evicted in Venice, who could live in one of those units, and now she's going to be homeless for the first time in her life in her 50s, in the cold. So there's a global camp out to end homelessness, or to end youth homelessness for Covenant House on November 21st. I would love to invite anyone who's in LA. Like, Reba's comments were amazing. Like, she's right. To maybe do a demonstration outside of these empty hotels and stay outside with us at night on the 21st. Thank you.
Thank you, Ruth. Right. Next, we have Brendan Dixon. Please go ahead and voice your comment.
Hi, everyone. Brendan Dixon here from the new Cal ICH Youth Working Group. And I just wanted to give my compliments to you guys for your ability as a group to discuss and let things sit and not be afraid of dead air when you're talking about really serious stuff, and letting things sort of absorb before having to move on. That's not common in a lot of spaces like this. So just plaudits for that. I have other stuff to say about specifically about Alex's bringing up of sort of the elephant in the room about the looming national political environment. I guess I'll just keep it to this, which is our elected leaders are buckling up for a really intense fight. A lot of them have experience with that before from the last time this administration was in power. It's going to be probably more intense this time and more difficult, and they're going to need support from people like you, acknowledging their efforts, and probably a withering barrage of very personal attacks from the national level on them as individuals. And then the other thing about losing hope, I want to just put my 2 cents in on that. The best thing we can do is expect the best and prepare for the worst. Expect a funding apocalypse, and plan accordingly. And that's the best way we can resist psychologically against the temptation to fall into despair and inaction. So thank you, guys.
Thank you, Brandon. All right. And Ayako, please go ahead.
Yes, good afternoon, Ayako Utsumi. Yes, I'm interested in the group's response to our equity lens, which is obviously very important, but so many of our state-funded programs, for example, Medi-Cal, CalAIM, the Emergency Response System, and other state-funded programs, we're not allowed to identify and prioritize, let's say, Black men, for example. So where does the rubber meet the road if we're supposed to have this equity lens, but some of our programs don't allow us to prioritize? How does this work? That's my question. Thank you.
Thank you, Ayako. I will now turn it over to Cody for final adjournment.
Great, thank you all. And just a reminder, because of the public meeting setting we're in, for questions, obviously, please reach out to us at our email address, which I put in the chat earlier. So thank you all again for being here today. Really appreciate your insights and comments during the meeting. As you can see, we're really trying to move our committee and our council towards work that is effective at achieving our overall vision of preventing and ending homelessness. So your participation, and for those of you members of the public who have joined and stuck it out with us here, your all's participation is really crucial to that. Our next committee meeting will be on February 5th at 2025. Wow. At 1 p.m. Please join us as well for our council meeting on December 3rd at 1 p.m. You can listen in. We will be sending out all the information about that soon. So check our website for that as well. And with that, the meeting is adjourned at 3:05 p.m. And to receive up-to-date information about the council's activities, please sign up on the council's email list. There's a sign-up option on our webpage. So yeah, stay in touch. So thank you all, really appreciate the time. And have a good rest of your week.